Good evening, and thank you for taking the time to attend our webinar, Compounding Crises, Climate, Coal, Pandemics, and Public Health. Now that we're all practicing social distancing and everything is closed down, it may be difficult to stay connected to what's going on in the outside world. And for that reason, we're very glad you're taking a couple of hours to spend some time with us. Before we get started, I wanted to help acquaint you with GoToWebinar if you are new to this tech. As an attendee, you will be muted through this call. If you have joined with the webinar link, you will have a control panel that is often at the right-hand side of your screen, although you are able to drag it and move it to other places. If you click the arrow to expand the control panel, you will see the options to raise your hand and to submit a question. Please use the question box throughout this webinar to send in questions. We are going to be batching questions into similar topics, and we'll answer several at the end of the webinar's prepared content. Additionally, if you have technical issues during the webinar, you can email one of our volunteers, Victoria, and she will try to help you troubleshoot. Her email address is torrig@gmail.com. Now that COVID news has taken over our news feeds, less coverage is devoted to the many other crises affecting our society. Yet it's important to remember that not only are these other serious issues still happening, they also build upon one another. These crises don't each exist in their own vacuum, but work in various ways to exacerbate one another. The effects of climate change, coal use, and pandemics are wide-ranging and affect many sectors of our life. But the theme that we would like to focus on tonight in this webinar is public health. Public health is a complex topic that is affected by many factors. But one thing that is undeniable is that it is worsened by a warming world, our continuing burning of coal, and the ravages of pandemics. The terrible shock dealt to our entire society by the virus showed us the inherent vulnerability of business as usual, and underscored the fact that this time to start building a resilient, clean energy world is now. Because these crises do not happen in a vacuum, our activism must span beyond those who are attending this webinar. We invite you to post on social media throughout this webinar with the hashtag #CleanEnergyNow, sharing what you are learning. We have a great lineup of speakers for you today. They come with different sets of expertise and all add something very important to the picture of connections between crises. We will hear about the roots of several different problems, as well as the solutions that can bring about better health for us all. Our first speaker is Claire Gervais, MD. She is a family practice physician and a clinical associate professor with the University of Wisconsin Department of Family Medicine and Community Health. She is the co-chair of Wisconsin Health Professionals for Climate Action, serves on the steering committee of the Wisconsin Environmental Health Network, and is one of the founders of the Healthy Lawn Team, a nonprofit organization which educates communities about the risks of lawn care pesticides. She works frequently with the City of Madison and UW Health to provide safer pesticide policies, and works with the Meadowood Health Partnership to bring both healthcare and healthy food to communities. Our second speaker tonight will be Jonathan Patz, MD, PhD. He is one of the lead authors of the UN Intergovernmental Panel on Climate Change and is a co-recipient of the 2007 Nobel Peace Prize for his work on the IPCC. Patz is also the director of the Global Health Institute and a professor and John P. Holton Chair of Health and the Environment at UW-Madison. In addition, he is the co-chair of the Health Expert Panel of the U.S. National Assessment on Climate Change and has authored hundreds of peer-reviewed papers on climate health. Our final speaker will be Dr. Armendariz, who is a regional deputy director for the Sierra Club, Beyond Coal campaign. Prior to his work with the Sierra Club, Dr. Armendariz was a regional administrator for the EPA. Throughout his career, he has spent countless hours volunteering to help protect America's air, water, treasured landscapes, and public health through various environmental groups. Without further delay, I would like to turn things over to our first speaker, Dr. Claire Gervais.
Thanks for that introduction, Soren. So yes, I'm a physician, but I'm also a concerned citizen and a mother that cares deeply about the environment and health. And coal is one of the most impactful environmental hazards that exists. And I hope to give you a little bit more information about why that is. You can go to the next slide. Coal impacts our health at each step of its life cycle. It starts with mining and then transportation and washing. You can go back. The combustion and disposal of post-combustion waste. Given the topic at hand, I'll mostly focus on the toxic effects of burning coal, but I'll go into a few other things as well. The slide that you're looking at now, I wanted to just point out a few things that, it does, when we burn coal, we are emitting a lot of CO2, and also CO2 is emitted at other steps of the coal cycle. And at the end, it shows coal capture and storage in this photo, but illustration, but it really, that's not something that we're doing. And I'll go into that a little bit too in my talk. Next slide. So coal is not clean. It's a very complex and dirty substance. Each step of the coal cycle, like I said, impacts health. The coal dust from mining, toxic substances in the coal ash after the coal is burned, also small particles in each of those steps, nitrogen dioxides, forming ground ozone. I'll talk about that today, and just a little smidgen on climate change. You'll get into that more. So note the fallacy of clean coal at the bottom of this slide. And we'll go on to the next. So I want to talk a little bit about coal dust, because we can't ignore that, the coal that comes into Wisconsin and gets burned comes from somewhere else, mostly from Wyoming in our state, though it also, there's a lot of mining in Appalachia. But interestingly, Wyoming is the largest coal producing state that we have. So there's a lot of black lung disease, particularly interesting in the Appalachia. And it's growing, interestingly, still. We're still seeing a lot of it. It's not an old problem. So you can see, coal miners rallying in this 1975 photo for protections, which some of they've been put in place, but there's still an issue there. Coal workers' pneumoconiosis, or black lung disease, and silicosis are both diseases that affect the lungs in that they cause scarring. They're rather similar. Once that scar forms, you can't reverse it. So it's a real problem and continues to be so. The silicosis comes from the silica in the coal as it's broken up. Emphysema and bronchitis are also problems from being exposed to coal dust. You can go to the next slide. At the end of the line, after we burn the coal, there's the byproducts, coal ash. There's a picture here of both fly ash, which is, it's from pulverizing the coal, and they blow it into the air in the boiler's combustion chamber, which releases the heat, and it ends up producing a molten residue. But in the process, a lot of the elements in fly ash can be a problem. They've certainly, put some screens, on the apparatus so that we don't get the fly ash into the air that much. But there's still some left, and we have to do something with it. The bottom ash is the coarser ash, and it's at the bottom of the furnaces, and same toxic substances, but not in as fine of a particle. Let's go on to the next slide. I want to spend most of my time on the toxic substances that are in coal ash here. As you can see, a list of elements, mostly heavy metals, though boron is in there as well. And in the plant that we're talking about in Wisconsin, at the Columbia plant, we found a lot of arsenic, boron, and molybdenum, and I'll get into that a little bit more later. But lots of dangerous compounds as well, including sulfur dioxide and nitrogen dioxides. Regulations were in place, that that's fine. You can stay at that slide. Regulations were in place during the Obama era on many of these toxins, but a lot of that is threatened to be deregulated now. So once coal ash is left from the burning coal, it has to go somewhere like a landfill or coal ash ponds, where it can get into the nearby waterway. It doesn't go away. And so the Columbia plant has decades of old unlined landfills that are along the Wisconsin River. Here's an article from just last year where they discovered leakage of 433,000 gallons of water per day with arsenic and molybdenum detected. You can go to the next slide. I like maps, so I went and looked it up. It's like, okay, where are these things? Because you're driving along the highway past Portage, and it's like, what are we talking about? We're talking about that area along the Wisconsin River, as you can see there, and Lake Columbia is there, where people fish. It's right next to Lake Columbia. It's very interesting. I thought that the contamination can get in there, and you can go to the next slide. One of the things that we look for with water and contaminants is mercury, and so there are lake fish advisories for Columbia Lake, and if you're a woman of childbearing age or a young child, there's less fish that you should eat. You don't eat the muskies, and only one meal a day of certain fish and 1 meal a month of other fish. Less restrictions on men, just because there's a lot of damage that gets done in utero when a woman is pregnant if they have a lot of toxic substances in their bodies. You can go to the next slide. So as you can see, all of these heavy metals have an effect on the body. I'm not going to go through each of these in great detail, but here are some of the coal ash heavy metals and the mineral boron that can cause problems in the body. We'll go to the next slide and we'll get into a little bit more detail with that. So arsenic, we've all heard of it, and I think some of us have a general sense that it does cause problems with kids in particular, but it's not just kids. So in early life, and I was talking about earlier that it's the mother who is the one that carries the burden of toxic substances that can be passed on to kids mostly. And so, before a child's born, already there are impacts from arsenic causing potential for preterm birth and low birth weight and neurotoxicity. A child could also have a tendency toward more infections from immune system problems. Later in life, as arsenic accumulates in the body, cardiovascular disease and lung disease becomes more of an issue, and cancers can take time to form. So over decades, cancers can form. Arsenic's also been associated with anemia and diabetes. I always find it interesting when I see diabetes on the list, because we always think of it as just a problem with what we eat or our inheritance, but there's many toxic substances actually that can contribute to diabetes. Go on to the next slide. So molybdenum, hard one to say, can cause problems for people. It's an element in coal, and here you can see on this slide just listing some of the issues that people may have from exposure: headache, fatigue, decreased appetite, muscle and joint pain. Gout. Gout is as a result of increased uric acid in the body affecting the joints. And then kidney and liver damage. You can go on to the next slide. Mercury is another one that people tend to have heard of because it accumulates in fish, as I was saying earlier. And in infants and children, there can be lifelong brain changes affecting their learning, coordination, reaction times, and other brain processes. And same with adults and older children. Cognitive thinking affects their coordination, balance, vision, hearing, and speech. Sometimes we think about this when we see adults in the clinic. Could there be an exposure that's causing their cognitive issues? And sometimes we check for that. Let's go to the next slide. Boron is a mineral that actually is needed in the body in very small amounts, but if you get too much of it, it can cause problems in the gastrointestinal system, as well as the liver, kidney, and brain, and can even cause death at high levels. You can go to the next slide. So I've talked about the, many of the toxic substances in coal, the elements, the heavy metals, and boron, the mineral, but I want to move on to another category, which is small particles, or PM, which stands for particulate matter, and specifically PM 2.5. So maybe you've heard of this, but PM 2.5 is an extremely small particle, and you can see on this illustration how small it is compared to a human hair. So if you breathe this in, it gets into the lungs, but then it goes from there. It advances into the bloodstream and can affect the heart and many systems of the body, and including the nervous system, digestive system, immune systems, and of course the kidneys, because we're filtering our blood there. And it can also even cause premature death because of its effect on these systems. Let's go to the next slide. So as I said, it penetrates the lungs and travels to all these systems, and it's responsible. Our PM 2.5 is actually responsible for 4.2 million premature deaths worldwide because of these effects. Interestingly, or unfortunately, I should say, people with heart and lung disease already, and also smokers, people of color and of low socioeconomic status are at most risk from PM 2.5. And that bodes true for so many environmental risks. Let's go to the next slide. Particle pollution is not tracked in every county of the country. And so it's not monitored in Columbia County. And it's kind of hard to see on this map, but if you kind of zero your eyes in Wisconsin, Columbia County is a little north of where the yellow is on the bottom. And so we don't have any data on particulate matter for Columbia County and this coal plant. Let's go to the next slide. I want to move on to ground ozone and nitrogen dioxide next. So ground ozone is not the atmospheric ozone holes. It's a separate thing. It's formed from a complex reaction between nitrogen dioxides, VOCs, and heat. And so, the hotter the planet is, the more you got. The more nitrogen dioxides you have, the more ground ozone you have. And it increases asthma and other respiratory diseases. There's on this illustration, we can see that actually years ago there was more of this than there is now, which is really good news that we've reduced ozone levels because of some of the legislation that has gotten into place to make our air cleaner. So that's good news. But it's still out there and causing problems around the world. Let's go to the next slide. So here's an illustration of that. There's a study recently that linked nitrogen dioxide levels and COVID-19 fatalities in Italy, Spain, and France region. And this is a map you can see where they've been able to figure out where the higher levels are. And this study said that actually it may be one of the most important contributors to fatality caused by COVID-19. That's a pretty strong statement, I'd have to say, in this era. It also, you can go to the next slide. Yes, thank you. Ozone increases the risk of asthma exacerbations, and it goes across all socioeconomic statuses in all communities. Kids are more likely to get asthma with higher ozone levels. Let's go to the next slide. And so lastly, I just want to touch on climate change because Dr. Patz is going to go into that quite a bit more. What I wanted to say about it is that I told you some good news about some of the regulations in place that are actually threatened, unfortunately. But there is bad news about CO2. There isn't any simple technology to remove it. We have a system called carbon capture, but it's very expensive and it's really infrequently implemented at this time. I think we're sort of at the cusp of getting rid of coal, and I don't think anybody's really investing in it because of the expense. It's important to know that CO2 is a pollutant under the Clean Air Act, but it's not regulated, and I'm not prepared to talk about that regulation, but there's a lot to that. So, and another interesting fact is that coal has more greenhouse gases per unit of energy than any other fossil fuel, and so it really does need to be phased out as quickly as possible. Let's go to the next slide. Here's a statement from a report for Physicians for Social Responsibility, which I'm also a member of, and WHN is part of that. But anyway, I'll just read it to you. Unless we address coal, the U.S. will be unable to achieve the reductions in carbon emissions necessary to stave off the worst health impacts of global warming. I think this still rings true. I mean, though it's a little more complex than that, but it's time. So let's go to the next slide. Because really the bottom line is that we do need to move beyond coal, because beyond coal means better health. It's detrimental and expensive to our health. It's really time that we put public health first and move beyond coal to a clean energy and healthy future. We've seen this before when we talk about COVID. It's time to build back better, and I think that this topic plays into that. The illustration below shows the price of coal on our health, from heart attacks, asthma, premature death, and hospital visits. We really want a clean environment and clean health. With that, I'm going to pass it on to our next speaker.
Okay. So I'm Jonathan Patz, and I'm going to just share the screen here. Sharing. Okay, sorry for the delay. Can you all see my screen? Thumbs up? If not, let me know. So this is the title, and I'm serious. Without reversing environmental damages, mark your calendars for the next pandemic, because it's all about the environment. And I'm going to break up my talk into three main themes, looking at COVID-19's emergence from disrupting nature, and first look at the proximate socio-ecological determinants of the emergence of this novel coronavirus that's causing our current pandemic. Then go upstream at some of the causal factors, which really it's a matter of human incursion into and disruption of nature. And finally, talk about preventing the next pandemic and new opportunities that our current situation is revealing. So we all know about this issue, the Chinese wet markets, and this is a combination of domesticated wildlife industry. The Chinese government is actually has this wildlife protection law that is for poor peasant farmers to raise wildlife to make a living, and the other part is illegal wildlife trade. And when you see a picture like this, stacking wildlife on top of each other, it's an unnatural environment, ripe for pathogens to spill over from one species to the next. And This is where you combine the domesticated wildlife industry in China with the illegal wildlife trade. This is a picture of a cute anteater, the pangolin, one of the most widely sold and now endangered species from illegal wildlife trade. And if you have any kids that are watching this, you're not going to like the next picture, because this is what happens to those pangolins, and this is, you know, part of the illegal wildlife trade. The SARS-CoV-2 virus, it's causing our current COVID-19 pandemic, is a near perfect match with the pangolin coronavirus. It's a bit of a combination. Most coronaviruses are found in bats, but they're also in other species. The one right now matches pangolin pretty well. And I know there are some people out there that are trying to pin this emergence of the novel coronavirus on human engineering, but in fact, there are genetic studies of this new virus that are very, very complex in looking at the mutations, and show that this is definitely not a human engineered virus, as conspiracy theorists are suggesting. So there is evidence, strong evidence, that this came from evolutionary forces in nature and species, spillover of virus from species to species. You know, this was nailed down to a fish market in China, in Wuhan, China, that also had wildlife. And after this event occurred, the spillover event occurred with international travel, very quickly this virus spread throughout the world. This is just looking at 1 week of international travel. Just so that you know, in the United States, most of the viruses in the United States genetically look like those from Europe. So probably this came through Europe to the United States for the most part, as opposed to directly from China. And of course, the rest of the story we all know about. So I want to go upstream and look at human incursions into and disruption of nature are the primary reasons we're seeing this pandemic. And I love this op-ed illustration, what the coronavirus pandemic tells us about our relationship with the natural world, and where this ties into climate change. Remember, climate change, it's about emissions from burning fossil fuels, but it's also about destroying the Earth's forests. Deforestation is about a quarter of the problem when we lose the carbon sinks from cutting down forests. So deforestation is disrupting habitat and leading to disease emergence at the same time. Now, this slide from my friend and colleague, Professor Raina Plowright, is really, it tells the whole story as far as the front end of the environmental influence on this novel coronavirus now causing a pandemic. And if you start at the top, looking at these tiles, put my glasses on here, you can see that this is representing the reservoir host distribution. So animals that are carrying diseases, you know, what is the distribution of them, and what is their density? And these two in particular, if you cut down a forest or chop up a forest into fragments, or if you have pollution and degraded landscapes, invasive species, if you damage the ecosystem, you're going to be forcing animals to be moving around. And if they're carrying infection, that density may change. That may change the pathogen prevalence in that host species. And that will lead to, for example, viral shedding if they're carrying a virus. And so that virus gets released into the environment. And then if humans are in, if you have human incursion into natural landscapes, for example, bushmeat hunting, then you have more exposure from these viruses in wildlife to infect humans. And then depending on human barriers and immunity and immune status, you get what's called a spillover event. So it's a rare event, but when all of these things line up, you have a spillover event. And this is something that is at the front end of this current pandemic. Now, we've known about this for a long time. This is a paper we did 16 years ago called Unhealthy Landscapes, and it's about how land use change leads to infectious disease emergence. So this is something to remember when you're thinking about preventing the next pandemic. It's not just about early surveillance, it's about stopping the degradation of ecosystems and our disturbance of natural systems. This is actually Professor Plowright. She made a big discovery in Australia when you saw the news about Hendra virus, a bat-borne virus that kills horses and can also kill humans that tend to the horses. And I'll jump to the end of the story, which is that the issue was that there was widespread deforestation and fires across Indonesia, which was disrupting bat migration. And fruit bat density started to increase in urban parks in Australia. And simply the proximity of those fruit bats and horses led to this epidemic of Hendra virus. So this is an example of habitat destruction and the climate change story with more forest fires, tropical forests, as well as deforestation, also has something to do with this. Now the cover image from my title slide, actually I saw that about a month ago. It was NBC doing a special documentary on emerging diseases, and you see these protected health workers looming over a burning forest. Well, it turns out that that documentary was about my former student, Dr. Amy Vitor, and our work in the Amazon jungle, showing a link between deforestation and malaria. And basically, we looked at places that had more extensive deforestation, and after controlling for human population density, for example, looking at abandoned agricultural sites, we found a strong relationship between the biting rates of the bad actor mosquito, the species called Anopheles darlingi, and deforestation. A subsequent student here at UW, Dr. Sarah Olson, then found that for every 1% of deforestation, there was an incident rate increase of malaria by 11%. So that's not trivial. And again, remember that deforestation is part of the climate change story. So I want to shift gears quickly and talk about climate change before I conclude. We all know these, the physical attributes of climate change: rising temperatures, sea level rise, extremes of the water cycle. And there are many pathways through which these physical attributes of climate change affect our health. Each one of these pathways has many climate-sensitive diseases that we're concerned about. But because we're talking about coronavirus, I'll just circle this in the middle here, that infectious diseases, especially those carried by vectors, like insects or rodents, and also waterborne diseases because of extremes of the water cycle and more flooding and contamination. These are part of the story of climate change effects. This is also not new. This is a paper we published, oh my God, 24 years ago in JAMA, Global Climate Change and Emerging Infectious Diseases. So we've known about this for a while, and it's not going away. In fact, pretty recently, we we saw some extreme climate conditions that had an effect on these diseases. This is the mosquito, Aedes aegypti, that carries yellow fever, dengue fever, and Zika virus. And just 5 years ago, when we had that big Zika emergence come into South America, take a look at the vectorial capacity or the ability of that mosquito to transmit virus. And this is a temperature-dependent vectorial capacity. And if you look over the last 60 years, the El Nino event of the winter of 2015 was so strong that the temperatures were more than 2 standard deviations above normal all across Colombia and Brazil and other parts of South America. So here you saw, Zika reemerged in South America. It turned out to be, in part, well, at least in time, it correlated very strongly with strong temperatures. And I had been telling people, because of the seasonality of dengue fever, and dengue and Zika are in the same virus family, and they're transmitted by the same vector, Aedes aegypti, that they probably behave the exact same way. But I was wrong. A couple of years ago, in laboratory studies, they found that the predicted thermal minimum for Zika transmission is 5 degrees warmer than that of dengue. So as dengue fever is very seasonal, and you see spikes throughout Southeast Asia related to El Nino warming, and so unseasonably hot temperatures can give you a stronger than expected dengue fever season. It's possible that this very extreme El Nino with very high temperatures throughout Latin America may have been a precursor to the eruption of Zika virus when we saw that occur. So I want to wrap up and talk about some of the obvious things we're seeing at the intersection of this COVID-19 pandemic and coal and climate change, and that is the air quality. There's no clear signal here. What could be any clearer than comparing today's air quality with business as usual, as you see on the left? And remember the WHO statistics that 7 million people die prematurely every year from air pollution. We saw satellite images of, looking at France, March of 2019 versus 2020. In the United States, the same thing, March of 2019 versus last month. And because we've shut down the fossil fuel economy, we see cleaner air. This is looking at nitrogen dioxide by satellite. And who would have ever imagined all of these megacities with, and so my question to everyone, and it's so important for this particular evening session, is, at this time, do we really want to uncork conventional fossil fuels, the fossil fuel economy? Or do we want a clean energy economy where everyone prospers? Oops. I think I lost something there. Are you seeing the screen still?
Yeah, looks great.
Oh, okay, interesting. All right. So my fear, though, is that as we see that clean air and the consequence, the positive consequence of shutting down a fossil fuel economy around the globe, there's a major concern. Will people fear the trade-offs of solving another global crisis? The price that we're paying to shut down the economy and social distancing, and look at the, the prices and value going through the floor. People are suffering. They're really suffering. And how ready are they going to be to solve another global problem? if they think, oh my God, we can't handle it, we can't handle it. But unlike the coronavirus pandemic right now, I would argue that unlike this pandemic, combating climate change could be free or even a net gain. And this has been my soapbox for the last 6 or so years: climate change challenges and opportunities for global health. Solving the global climate crisis, the greatest opportunity of our times. And just a couple months ago, we published in JAMA, a low carbon future could improve global health and achieve economic benefits. Just a reminder of, what it might cost to invest in clean energy, to avoid emitting 1 ton of CO2. Maybe there's some cost, maybe up to $30. But as Claire mentioned, when you burn fossil fuels, it's not just CO2 that you're burning. You're releasing harmful PM 2.5, nitrogen dioxide, sulfur dioxide, lead, mercury. So, every time you avoid emitting 1 ton of CO2, you also avoid emitting those hazardous pollutants. And if you just look at the benefit of how much lower the emissions of PM 2.5 would be, and what that effect would have on reduced mortality and hospitalization from breathing fine particulate PM 2.5, the benefit is much larger. And I ask policymakers, what number is bigger, 30 or 200? And they say, wait, we've just been thinking about the investment costs of $30 that we don't want to pay for, and we don't realize they hadn't put in the equation the huge health benefit from cleaner air. So I'll end by, this is from an op-ed from Mary Robinson, former president of Ireland and UN High Commissioner for Human Rights, and is now the chair of the Elders. She wrote this op-ed with Dia Reddy, Tackling Climate Change with COVID-19 Urgency. And this is from Christiana Figueres of the UN FCCC and a colleague. We can't lose sight of the climate emergency when dealing with the COVID-19 pandemic. And I'll end by this wonderful image I saw in this op-ed: why don't we treat climate change like an infectious disease? Because after all, climate change is a global health emergency. So with that, I thank you very much for your attention, and I will unshare my screen and yield to the next speaker. Thank you very much.
Hey, so good evening, everybody. Thank you, Jonathan. And so good evening, folks. As I was introduced, I'm Al Armendariz. Let me make my screen just a bit larger here. And I'm a staff member of Sierra Club. I work in the Beyond Coal campaign, and I'm really happy to be on the webinar with you tonight. And so I was asked to talk a bit about coronavirus and some of the new research that's coming out that connects the coronavirus and air pollution. So I'm going to start a little bit about what is it that is happening in the body that makes air pollution harmful. And it turns out that there's some really interesting science that's coming out about particulate matter and how that impacts the outcomes if you're unlucky enough to be infected by this particular virus. And there was an interesting study that came out of the School of Public Health at Harvard that some of you may have heard of. So I'll go over that, and wanted to kind of start off a little bit with just a quick view as to what is it about air pollution that makes it harmful. And there's a couple different reasons why. One of them is that air pollution, it can actually damage some of the structures in the human lung. So if you look at this image over here on the left, you see that kind of fuzzy, almost hairy looking thing. And that's a blow up of a microscopic picture of the lining of the human pulmonary system, where you have these little tiny cilia. And what these cilia do, they line the insides of some of your airways, and they catch airborne particles, or airborne particles deposit on them as you're breathing in and out. And what these cilia do, they actually have a really fascinating mechanism to take that stuff and to clear it out of the lungs. So they're just constantly filtering out, capturing and removing airborne particles before they have a chance to do damage in the lung. Now, one of the bad things about air pollution is that different kinds of air pollution can actually damage those cilia. And so what you see here in the chart on the right-hand side of that image is data showing the ciliary volume density, basically a measure of how healthy and how much of the cilia do you have in your system. And they took some volunteers, and you can see if you're breathing filtered air, you have that larger, tall bar on the left-hand side of that graph. But then if you expose these volunteers to levels of ozone, ozone is that summertime air pollutant you get in a lot of big cities and causes like these orange alert days and red alert days. You give everybody kind of a short, large burst of that ozone. What you see is it really damages the cilia volume. And the images look kind of all cracked and shriveled up and deformed. And so ozone air pollution can really damage that cilia, which just, it removes the protective mechanism that your pulmonary system has. And you see that other bar of episodic ozone. So you don't give the volunteer a huge burst of ozone. You just kind of consistently pulse them with daily peaks of ozone. And again, you see that the cilia take damage. So this is one of the ways that air pollution harms your pulmonary system and the respiratory structures that you've got, is by going after the cilia. Another way is by causing inflammation. And this is an image out of a study that gave some nice background as to airborne particles, so-called particulate matter, or PM. And why is it that you can see effects in organs all over the human body when someone is breathing in high levels of these particles? And it turns out that there's a lot of reasons why breathing in airborne particles can be harmful, but one of them is inflammation. That when you breathe in these particles, not only do they bring in some of these heavy metals that the other speakers have been talking about, so they can bring in things like lead and arsenic, but also the particles themselves will cause basically an immune or inflammation response in your lungs. As the particles then get into your circulatory system, they can cause blood vessels to become inflamed. You can see inflammation in the nervous system, and you can find systemic inflammation really all over the human body. One of the interesting and kind of dangerous things about particulate matter is that you find pretty serious cardiovascular effects. And so you'll find irregular heartbeats, increased incidence of stroke, and so just a whole host of bad outcomes that lead to really poor public health for people who are exposed to high levels of particulate matter. So now, before I go farther in, before I came to work at Sierra Club, as I mentioned, I used to work in the US EPA. I was in the first Obama administration. So I worked for the president as the regional administrator for the regional office in Dallas, and did that during his first term, which was a whole lot of fun. But prior to working at EPA, I was an academic. So I was on the engineering faculty at Southern Methodist University, Go Mustangs, down in Dallas. And so I am going to give you a quiz because I am a former academic, and it's what we do. So here's a pop quiz. There is a chat bar in your GoToMeeting. So if you look at the little GoToMeeting kind of control center that's on your screen, you'll see there's a chat function on there. And so everybody has to answer. And so here's the quiz. So the question is, who discovered viruses? Oh, excuse me. I clicked on something accidentally. Let me go. Uh-oh. Here we go. All right. So, shoot, there we are. I'm trying to just give me 1 second here. There we go. Okay. So we have 4 choices. Antoine Lavoisier, who some of you might know is a very famous French chemist. Charles Darwin, British naturalist, a lot of people have heard of. Louis Pasteur, French microbiologist, and Gregor Mendel, who I think was Swiss. Some of you might remember from middle school, high school biology classes. He was one of the first scientists really taking a look at genetics, and he was using pea pods and pea plants and the colors of different peas to study genetics. So, so here's the quiz question: who discovered viruses? So go ahead and put your answers 1, 2, 3, or 4 in the chat. And And come on, everybody's got to vote. All right, so here's the answer. Turns out it's a trick question. It was none of those four. It was this guy, and who no one's ever heard of, Martinus Willem Bouguer-Nick, lived from 1851 to 1931. He was a Dutch chemical engineer, a microbiologist, and a botanist, and he actually is the person who discovered viruses. And he named his discovery after the French word for venom, which is I think venin, which in English became the word virus. So there is an American connection to the discovery of viruses, which is in 1901 in Cuba, U.S. Army Dr. Walter Reed. He was the first person to isolate the pathogenic human virus. So he isolated the yellow fever virus and was able to purify that. And that was the first isolation by anybody of a virus that caused disease in humans. All right, so with that, I wanted to go back to that image of human hair. So that human hair strand, you see that human hair strand there, to give you a sense of how fine these particles are. So if you look at these kind of boulder looking things off to the left of that human hair, so that's gives you a visual image of beach sand, and then about 90 micrometers in diameter. And then you see that human hair strand about 50 to 70. And if you divide that, you can see PM10, which is bigger airborne particles. You might actually see those if you're ever kind of lying down on your couch and you're looking up and you have to kind of raise the light, see things floating around. Some of that might be PM10. But then if you really finally divide those down to 2.5 microns, that is the size of the particles we're talking about. So they're really, really, really small. If you're ever behind a diesel truck that's taken off from a light, you know, you have like a rock hauler or something and the light is red and the light turns green, the truck pulls out, and you see that big puff of black smoke go into the sky. What you're looking at there are really billions and billions of fine carbonaceous particles that are coming out of that diesel truck. So what you're looking at there are very, very fine particles. So I did want to show some information here about where particulate matter comes from and what it's made out of chemically. So particulate matter is just a mix of just all kinds of crap that humans put into the sky. There's two general categories of them. There are primary particles. So those are particles that are particles as we emit them. And so they can be carbonaceous, which is kind of this black octagon, crustal. So that's like airborne dust. I grew up way out in West Texas. We'd get these sandstorms where the winds would pick up and you'd get just a lot of wind-blown sand. It's very common across the Western US, and you can get that in the air. Then over here on the right-hand side of that are what are called secondary particles. What secondary particles are, those are particles that are formed from gases. So the kinds of things that you might see being emitted by a coal plant, like sulfur dioxide, SO2, which is emitted in very large quantities from coal plants, or nitrogen oxides, NOx, that you see from coal plants, but also cars and trucks. Those kinds of things get into the atmosphere, as well as vol organic compounds from things like refineries or chemical plants. And those things over time with some sunlight and chemical reactions can also form particles. So airborne particles are just a toxic mix of just all kinds of different things that human activity and some natural sources are putting into the sky. Where they come from, well, they're really coming from, a couple major sources. So sulfur dioxide, for example, electric utilities are the major source in the United States, some from other kinds of fuel combustion. Nitrogen oxide emissions, the biggest emitters of those in the US are highway vehicles, cars and trucks, but also electric utilities are a big source, off-road vehicles, and other industrial processes as well. So, all right, I wanted to go a little bit over why particulate matter is important when we're thinking about the coronavirus. This little bar here that's been giving me fits. I'll just stick it off to the side. There we go. All right. So, so when I was at EPA, we moved forward with enforcing some parts of the Clean Air Act that had really been sitting dormant for a very long time. And as part of moving forward with Clean Air Act regulations, you do cost-benefit analysis, and what you see is that by far, particulate matter is the most important air pollutant for public health impacts for all of these clean air rules. So for many of the clean air rules that the US EPA was moving forward with, what you found is that there's certainly costs for reducing air pollution, but there are huge public health benefits. And the public health benefits of a lot of these clean air rules really come from removing particulate matter or the gases that turn into particulate matter out of the air. There are other very important kinds of air pollution like ozone or nitrogen dioxide or lead. So I don't want to say that none of the others are unimportant because in certain parts of the country, ozone pollution is very important, or lead pollution can be very important. But by far, the thing that is causing the most cost in terms of health and fatality is particulate matter. And all right, so let me wrap up here by taking a look at this study that was done out of the School of Public Health at Harvard. So what they intended to do is really look at the connection between long-term average exposure to fine particulate matter and the risk of COVID-19 death in the United States. And so here are the names of the authors that did the study. And so what did they do? They basically took two sets of data and did a statistical analysis of the relationship between the two. Here's a map that shows the long-term average levels of particulate matter across the United States. So the areas that are blue tend to have less particulate matter in the air. Yellow is kind of in the middle, and as you get to kind of that darker kind of brownish maroon color, those are the areas that have higher levels of particulate matter. This is a map that this team from Harvard constructed even before the COVID-19 pandemic, and it's made out of a kind of an amalgamation of satellite-based measurements and ground-based monitoring stations. So you put those two things together and you can create a long-term exposure map of how much particulate matter is in the air across the United States. So you generally see high levels in California, which is one of the kind of historic case studies of air pollution in the US because of the geography and the number of people who happen to live in California. And then if you draw a line just up and down the United States, kind of Interstate 35 that runs north-south, every place east of that tends to have the higher than average levels of particulate matter in the US. And so what they did is they compared that map to this map. So this is a map showing the fatality per million deaths for COVID-19. And so what they wanted to do is really compare those two slides. So this COVID-19 map, everywhere in blue, those are counties in the United States as of April 4th that had not yet had any reported fatalities from COVID-19. And the places that are color-coded on the map are the places that had. And so they really wanted to look at the relationship of one of these maps to the other. So on a county-by-county basis, is there a connection between the counties that have greater levels of airborne particle pollution and is that related to the fatality from COVID-19? So I did want to note that, okay, this study from the team at Harvard is still in the process of peer review, which is the process of putting your data out there so it'll be scrutinized and critiqued and potentially supported by others in the community. So it's a very important scientific process to make sure that we really get really the best studies published with the most important information, that it stands up to the scrutiny of the others in the community. So the study is still in the process of being peer reviewed. And the team at Harvard, though, given the emergency and what they think is the importance of this study, they've actually published two iterations of the preprint. So they released the initial study and they then updated it a couple of weeks later. And so what I'm going to show you here is the most recent version of their results. So they've actually had two rounds of results. This is the most recent one, and the most recent round found that for every 1 microgram per cubic meter increase in particulate matter, there's an 8% increase in the COVID-19 death rate. It was statistically significant, and they did a whole number of sensitivity analyses and examination for different things that could confound the results. The first time they released this paper, they actually published a 15% increase. So the first time they did the study, there was a 15% increase for every 1 microgram level of pollution getting worse in the air. And then a couple weeks later, when they redid the analyses and reran the numbers based on the most recent fatality rates, then the number they got was an 8% increase. So still really, really significant. To give you a sense of how important that is, so where I live in Tampa, the air quality and average level has about 8 micrograms per cubic meter. You go up to a city like Pittsburgh, level of particulate matter is quite a bit higher, about 14%. So the difference is about 6. You take that 6 times the 8%. So there's a 48% increase in the fatality rate that would be expected for nothing else other than the fact that someone lives in Tampa versus someone lives in Pittsburgh if that person is infected by the coronavirus, which is huge. I mean, this is a much larger increase than you typically see in air pollution studies. So if you're typically looking at the effect of ozone pollution in a city that has high levels like Los Angeles versus a cleaner city like Seattle, you typically don't find such large increases in mortality. And so this is an extremely significant result in terms of just the magnitude of the impact. And I did want to kind of highlight that this really important paragraph in this Harvard study said that the results of the paper suggest that long-term exposure to air pollution increases vulnerability to experiencing the most severe COVID-19 outcomes. And they also said it aligns with the known relationship between PM exposure and the cardiovascular and respiratory comorbidities that dramatically increase the risk of death in COVID-19 patients. And the last thing to mention here is that this connection between particles in the air and death from the COVID-19 virus is consistent with what was seen in studies back in the early 2000s when scientists were looking at airborne pollution and fatalities from the SARS outbreak in 2003. So this is really strongly suggesting that having a healthy respiratory system, healthy lungs, gives you a better chance of fighting off this virus. And people who are living in places with high levels of air pollution are going to kind of come into this pandemic with lungs that already might be experiencing a fair amount of inflammation, an immune system that is already kind of running a little bit too hot, and then this virus comes along and just your system is in poor condition from the beginning, rather than being healthy enough to be able to fight this virus off and send you home. So, all right, so those are the different points I wanted to bring up, and I wanted to thank everybody for joining the webinar, and I'll pass it back to, let's see, who's next?
That would be me.
Oh, hey.
Hey.
All right, thanks, Victoria.
Absolutely. Oh yeah, thank you, Dr. Armendariz and Drs. Gervais and Patz for sharing your expertise with us this evening. I've learned so much, and I'm really glad that this was all recorded so I can go back to it again when I'm so inclined, which is really nice. I'm Victoria Gillet, here with just a few closing remarks before we transition to the question and answer portion of tonight's webinar. I'm a third-year internal medicine resident at the University of Wisconsin. I'm a member of the Wisconsin Health Professionals for Climate Action and an active volunteer with the Sierra Club. I also happen to be working nights right now, taking care of COVID-positive patients at the Madison VA Hospital. Luckily, I had tonight off. This month, I'm about as frontline as I can possibly be when it comes to this pandemic, and that's come with all sorts of challenges. And though navigating this pandemic has been stressful, it doesn't scare me the way that climate change scares me. The human cost of rising sea levels, strengthened natural disasters, permanent infrastructure damage from our changing climate is what keeps me up at night, at least when I'm not supposed to be up at night taking care of patients. I am confident that our society and our healthcare system will recover from the effects of this novel coronavirus. I am much less confident about our ability to adapt to a rapidly changing climate, particularly without making some big societal changes very soon. So alongside the work I do caring for particular patients sitting in front of me in the clinic or in the hospital, I work with these two wonderful organizations that helped us put on this webinar today to replace fossil fuels with renewable energy generation. If you feel called to help us enact change, I have a few suggestions. So the Wisconsin Health Professionals for Climate Action is presenting oral testimony next week at the upcoming FDA hearing on ambient air quality standards for particulate matter. So extremely relevant to what we talked about tonight. And they're specifically advocating that those standards be further tightened. It would be really helpful for them to have some specific comments from members of the community, especially, I mean, any member, but including healthcare community members. And it would be great if you were interested in that to send an email to the email address that's on the slide, wisconsinhpca@gmail.com, with a personal comment to be added to that testimony. We are also in the Sierra Club doing a week-long week of action to try to close the Columbia coal plant. This is a part of it, but we have 2 more days on Thursday and Friday. So as a part of that, you could pick up our yard signs promoting clean energy from Willie Street East tomorrow or Friday. And on Friday, we are doing a social media storm that you could be a part of. Information about that can be found on our different social media platforms, which are also on the slide. So those are sort of short, contained things that you can do this week, but you can also keep the momentum going by joining either of these groups. So you can join the Wisconsin Health Professionals for Climate Action, I switched those around, through their website that has a volunteer form, or you can volunteer for the Sierra Club. The Wisconsin Health Professionals for Climate Action is developing a wide variety of climate-related education, outreach, and advocacy projects for health professionals. And if you volunteer through the Sierra Club, we have a huge range of options, ranging from our monthly volunteer nights to occasional short-term projects to being a part of a campaign team like the Beyond Coal campaign team, which prepared tonight's webinar. So lots of little things to do and big things to do. And we will very happily take any questions that have come up for folks throughout the webinar. I know that some have already come in, but feel free to keep typing them in the chat as you go.
Excellent, thank you so much. We have a couple of questions that have come in. So the first one, I think anyone can answer. There was a lot of talk about health concerns and pollution related to climate and coal in particular, but could you discuss the solutions and clean energy and kind of the path forward in more detail?
Yeah, I'm happy to kick off. So we're very lucky right now that there are renewable energy solutions for a lot of the things that we use fossil fuels for. And it was probably the case that when I was a kid, solar panels just didn't make economic sense. But if you look at the price curves and how inexpensive solar as well as wind power are in the United States, they are less expensive than fossil fuels in many cases. And so for sure on the electric side, which is the part of the work that I know the best, there are really no excuses to continue using fossil fuels moving forward. We can replace our use of fossil fuels with renewable energy, wind, solar. We can put batteries online. We do have to be smart. You know, we don't want to do things in haste. There are plenty of really smart engineers that work at these utilities and the different organizations that manage the electric grid, but we can do it gradually, but deliberately. We've got to get going. We've got to start replacing coal plants in Wisconsin, across the United States, getting them offline one after the other, replacing all of them with renewables. It's something that we can do. On the transportation side, you know, the electric vehicles are really the solution. We've got to electrify transportation. That's the ultimate solution. Right now, there are some price issues. You know, it's hard if you're a working class family, if you've got a used car to envision a lot of low income folks, going out and picking up Teslas in the United States. We're still not quite there yet, but the cost of batteries are also coming down. And so I think we will eventually be at a point where we can electrify transportation at a big scale as well. So I think the technology is there. It's simply a matter of initiative. We've just got to get going.
You know, I'll just point out that the International Renewable Energy Agency 2 years ago found that for the first time ever, the cheapest way to generate electric power was by renewable energy and batteries. Never happened before. And as Al mentioned, the price of solar not only has dropped, it has dropped so fast that a colleague of mine, Greg Nemeth, wrote a book on why solar got so cheap. So it's been, it's a new world as far as, the price of renewables. We don't need to wait around. Now, of course, COVID has turned the price of oil into negative territory for a while. So who knows about that, although it means it's a terrible time to invest in fossil fuels too. We did a study, actually it was led by Dr. David Abel, a student of Tracy Holloway, looking at Wisconsin. And the question was, can Wisconsin get all of its electric power from renewables, or stop importing electricity from sending money out for coal purchases, And the answer was yes. If you left nuclear just as it was at 4%, you increase conservation, and you take about 30% wind, 30% solar, Wisconsin can generate all of its electricity needs from renewable energy and that tiny slice of nuclear. And that would create, that would net 160,000 new jobs and save $21 billion annually in mortality and health costs because you don't have that much PM 2.5 in the air. Golden opportunity.
Excellent. Our next question is that it can be really frustrating when decision makers don't understand science or public health. Do you have any thoughts on how to get through to these decision makers?
Well, I can start with this one. So Jonathan and I had the experience of talking to one of our senator's offices on 2 occasions, and I think our strategy the second time around was better than the first time around. We learned how to talk to them. And I think, well, first of all, the health message is very important. There, doctors and nurses are probably more than doctors, the most trusted voices. And when you start talking about health, you cut the parties. You cut across the parties. And so talking about health is important. And though, somebody may not believe in climate change in the way that, most Americans are convinced of, you can talk about clean air. You can talk about clean air, and you can show studies that way and get your points across. You can also show that study that Jonathan mentioned, and you can get bipartisan support that way.
Excellent, thanks. So we have more questions in the chat box than we can get to, but there are a couple that are kind of grouped in similar categories. So the next one is, how many coal plants are left in Wisconsin, and are there advocacy initiatives to shut these coal plants down?
Yeah, so I think I certainly know the answer to this. There are 7. In the Wisconsin branch of the Sierra Club certainly has multiple things going on to try to get, in particular, the 2 that are most impactful for public health closed down. So that's the Columbia Energy Center near Portage, and the South Oak Creek coal plant near Milwaukee. Our goal is certainly to have all of them closed sooner rather than later. But there are a variety of different initiatives from us and other members of the environmental communities in Wisconsin that are working to get them, first step is to get the companies to agree that they will get them shut down.
Great. This next question has a lot of pieces because I'm cobbling together a couple of different questions. So One is about fracked gas, or commonly called natural gas, and how it's believed that that is a bridge fuel, and asking if you could talk about how that is not a solution and how gas impacts our health. And then related to that, there are several questions about, you know, what sort of initiatives have there been to offset some of the environmental costs that renewable energy might have? So batteries, solar cells, some of the things that clean energy has been critiqued for. So kind of two different questions, but I'm going to ask them both at once, and whoever would like to answer can start.
Well, I'll take the second one. So I'll say it this way: there certainly are environmental impacts to renewable energy technology development and manufacturing, but I've certainly seen a lot more fear mongering along these lines than I've actually seen things that give me real concern. You know, and so while it's true that there's a certain amount of energy, for example, to make a wind turbine, you know, to make the steel and make the fiberglass and make the paint, the amount of electricity that turbine is going to generate over its lifetime of 20 years, and the amount of pollution that is going to replace from burning coal completely dwarfs the amount of pollution it took to actually make that wind turbine. And so I've come across quite a bit of just misinformation and fear mongering by fossil fuel defenders who, for some reason, have grown very concerned about what goes in our landfills and are trying to convince people that solar and wind have this massive solid waste footprint and take more energy to manufacture than they'll ever produce. And so again, I'm not trying to say that there are no environmental impacts from the making of the steel and the fiberglass and the silicon and all the other things. But at the end of the day, the environmental benefits, once those things are online and run for 20 years, and the amount of coal pollution that they take out of the sky by running is completely, like, orders of magnitude greater than the amount of pollution that was produced when those things were actually manufactured. And the good news is that the cleaner the electric grid gets, then as we run those steel mills to produce that steel, or the, you know, as we produce the silicon and fiberglass, those technologies will also get greener to make in the long run as well. So now we certainly should recycle what we can, you know, the lithium batteries, the steel in towers, those kinds of things. So we should definitely look for ways to reduce their environmental footprint. But in general, those are not concerns that I think in any way get in the way of rapid deployment as quickly as we can.
And speaking of the 20 years that those pay back, this gets to the other problem of frack gas, which is anytime you build infrastructure, it's going to be, you're stuck with it for the next 20 to 30 years. And to the extent that renewables have become so cheap and are really market competitive now, there's not a good reason to go to natural gas. There are a few things that cannot be electrified. I don't know that we can fly planes, electric planes yet, but as co-hosts and as we are sitting here on a webinar, you know, we don't have to fly so much either. So, you know, so I think that this idea of frack gas, it's definitely better than coal, but to be investing there when we know that it's going to be an infrastructure that lasts for decades, when we can easily leapfrog to sustainable energy that has just unbelievably dropped in price. And there are hazards to frack gas, you know, from the water contamination to the leakage of methane, which is 20 or 30 times more potent greenhouse gas than CO2. So, you know, natural gas is a good thing, kind of, sort of, right now, but it's not really a place to go invest and grow when we already have cleaner solutions.
I'd just add one more thing about methane. I've seen numbers as high as, well, I've seen 84 and then over 100 times greater potency in terms of greenhouse gas over a 20-year time frame. So certainly, methane related production is not good.
Great. And I'll end with this last question. So this is a question for all of you. Do you see any hope that us as humans can take on this opportunity to solve climate change? And if yes, what gives you that hope?
Well, I mean, I think this pandemic is a wake-up call in many ways. Number one, I think people are realizing that science does matter, and maybe we do need to trust scientists and data. And secondly, that things that are global affect everyone. And this idea that we can just live in a bubble and be disconnected from events globally, I think people have woken up to that. So the fact that we're in a global world, the fact that science matters, immediately gives us an advantage now to start talking about climate change as a global threat. And I think that we have to be careful right now. We have to thread the needle because people are suffering from this pandemic and they're out of work and they are, this is a crisis. Yet at the same time, the way we're spending trillions, which is also another lesson that, oh my gosh, we can snap our fingers and invest trillions of dollars. We never realized that we could do that. I mean, when we think about climate. So I think that this is where we have to be sensitive to the immediate crisis, but see that, it's a global threat and climate change can be viewed in the same way. And as long as I think we do need to talk about benefits and not just risks, because there are huge benefits to a low carbon society. I think people will be, if done correctly and strategically, I think people may be more receptive to hearing about a fight on another global challenge like climate change.
I guess the thing I would say is I am optimistic that we will transition away from fossil fuels. In a sense, for me, climate change, it's not really a yes/no question. It's not like a football game where you either win or you lose. It's much more about the degree. There's already a fair amount of environmental damage that we've baked into the system. There's a certain amount of warming that we've experienced already, and that is likely to happen over the next years and decades to come. For me, it's a question of how bad is it going to get by the time we finally get off of fossil fuels. So it's a question of degree. Is it going to be just okay? Is it going to be bad? Is it going to be really bad? Is it going to be catastrophic? We're kind of shooting in there, and we have the technologies in hand. We have electric vehicles, we have wind, we have solar. It's a question of policy and financing, and we can save money, we can improve public health. There are a lot of reasons to do it. We just need to get the right, to be frank, we need to get the right people in the White House. We need to get the right people in the U.S. Congress. We need to get global governments aligned. And then if we get good public policy, it's not an engineering question anymore. I mean, Jonathan brought up a good question. We probably are going to still need to use fossil fuels for certain slices of the economy for a while, like flying big airplanes, or making steel or making cement. There are certain industrial processes that right now we don't know how to do without burning a lot of something, but those are down in the 5 to 10 to 15% range of what we're putting in the atmosphere. So let's go after the 75%. Let's stop burning the Amazon. Let's stop burning coal. Let's get off of oil and electrify the vehicles. We know how to. Those are things we could do starting tomorrow. There's no reason not to do them. And then we take the energy of all the really smart people like Jonathan and let's get them then focused on the 5, 10, 15% that are going to be really hard to solve, right? How do we get a 747 in the air without jet fuel? That's a fascinating problem. Someone should work on that. But right now we're still trying to grab the low-hanging fruit. We do. It's not an engineering problem anymore. We've got the technology. It's a public policy question at this point.
I just wanted to comment that the thing that gives me hope is all the cities, the counties, the states that are charging ahead and saying, we don't know how we're going to do this yet, but we want to be net zero by 2030 or what have you. There's a lot of commitment out there. We're seeing hospitals doing that. The University of Vermont Medical Center has put a solar array on. Harvard Medical School has made some commitments to decarbonize. Across the country, we're seeing examples, and in other countries too. So we're seeing a lot of leadership and examples, and I think if we just highlight those and keep duplicating those efforts and finding ways to do this, there's definitely the means, as we've already expressed.
Great. Well, thank you all. This was a really excellent discussion. Victoria, would you like to share your answer to that question and then help us close out today's conversation?
Sure. So specifically thinking about the recent weeks, I have had a lot of time and space that I wasn't expecting to have over the past couple of months, and was able to really refocus on what mattered to me. And I think that that is a theme that I've seen repeated across social media, sort of regardless of what people's political or environmental leanings are. And for me, that gave me more opportunity to engage in helping this come to light and working on other initiatives and educational opportunities towards building a just and hopeful future. And I am hopeful that I'm not the only person doing that right now, and that this has given us a little bit of a global perspective that maybe we can take more time to focus on what matters, and that'll be different for different people, but for some of us it's this. And if you are also feeling that way, if you're feeling inspired by tonight's material and by all of our wonderful speakers, and I'm so grateful for our presenters and you guys for coming and sharing your expertise, and for everybody who attended and spent a good chunk of your random evening to be here with us. There's a lot that can be done. If you're a healthcare professional, especially in Wisconsin, joining the Wisconsin Health Professionals for Climate Action, trying to get your local health environment or your health group to decarbonize, trying to use your physician or other healthcare professional voice at the Capitol. There's all tons of initiatives, or joining the Sierra Club, trying to get those coal plants shut down. We're doing a lot of stuff with Columbia right now. There's a lot of opportunity, and hopefully people can take some space to seize upon that, because even if we want things to change in theory, we need kind of all of us to be doing it. So I think that's what we've got for tonight, and I hope to hear from other people soon through one of these venues, and so grateful for everybody for joining us tonight. Thank you so much.